Heart disease continues to be the leading cause of death worldwide, which is why paying attention to the subtle warning signs your body sends can be crucial. Recognizing these signs early can help you take preventive measures to maintain your heart health. In this video, we will examine 7 important signs that could indicate a heart issue and offer practical steps you can take to address them. Heart disease is often referred to as a silent killer because many of its symptoms appear gradually and may go unnoticed until the damage is significant. Early intervention is key to preventing further complications. By understanding the signs of heart disease and knowing when to seek help, you can significantly improve your chances of managing and preventing cardiovascular problems. While some symptoms may seem unrelated to heart health, they can be crucial indicators that shouldn't be ignored. For example, many individuals may experience early signs such as unusual fatigue, shortness of breath, or even changes in their skin and hair, all of which could be connected to cardiovascular issues. In this video, we will explore 7 visible signs that might suggest your heart health needs attention. These signs, though sometimes subtle, can offer valuable insights into the state of your cardiovascular system. By recognizing these symptoms early, you can take the necessary steps to protect your health. 1 Frank's sign, the diagonal earlobe crease. One of the simplest yet most significant signs to watch out for is Frank's sign, a diagonal crease in the earlobe. This crease runs from the top to the bottom of the ear, and while it may seem trivial, it could indicate a serious issue related to coronary artery health. Research has shown a strong association between the appearance of this crease and coronary artery disease, a condition that restricts blood flow to the heart. The reason why this sign is so important is that it can serve as an early warning of blockages in the arteries. If you notice a diagonal fold in your earlobe, it is advisable to consult with a healthcare professional to assess your cardiovascular health. It's important to understand that not everyone with this crease has heart disease, as it can also occur naturally with aging. However, if you're young and notice it, particularly if it's accompanied by other risk factors like high blood pressure or high cholesterol, it's worth seeking medical advice. It's fascinating how a simple feature like the ear can serve as an early diagnostic tool for heart disease. In fact, studies have shown that around 70% of individuals with Frank's sign may be at risk for heart problems, especially if they are younger. So even if this sign doesn't guarantee an immediate problem, it serves as a useful flag for further examination. 2. Hair loss in the legs, peripheral artery disease, PAD. Hair loss on the legs is another signal that should not be ignored. While many people experience hair loss for various reasons, when it happens in the legs, it could be a sign of peripheral artery disease, PAD, a condition where the arteries supplying blood to the limbs become blocked or narrowed. This restriction of blood flow can lead to poor circulation, making it difficult for your legs to get the oxygen and nutrients they need. PAD can lead to serious complications, such as slow-healing wounds, severe leg pain, or even amputation in extreme cases. If you notice hair loss on your legs or feet, it's important to have your circulation checked by a doctor. PAD often develops gradually, and other symptoms, such as leg cramps, aching, or a feeling of heaviness, may accompany it. Early detection is crucial, as PAD is treatable with lifestyle changes, medication, or in some cases, surgical intervention. In addition to hair loss, a decrease in the ability to walk long distances without pain can be another warning sign of PAD. The key to managing this condition effectively is regular monitoring of your circulation and cardiovascular health. Don't ignore these warning signs. Taking early action can prevent the condition from progressing and reduce the risk of severe consequences. 3. Xanthelasma, yellowish patches around the eyes. Xanthelasma are yellowish plaques that appear on the eyelids, particularly around the upper eyelid. These deposits are made up of fat and cholesterol, and while they are generally benign, their presence can be a signal of elevated cholesterol levels and increased risk of heart disease. Xanthelasma is more common in older individuals, but it can also appear in younger people, especially if they have an underlying lipid disorder. While xanthelasma itself isn't a direct cause for alarm, it can be indicative of an underlying condition such as hyperlipidemia, high cholesterol levels. If you notice these yellow patches around your eyes, it's essential to check your cholesterol levels through a blood test. Elevated cholesterol can lead to plaque buildup in your arteries, which may eventually cause coronary artery disease or other heart problems. Having xanthelasma can also be a signal that your body is not metabolizing fats correctly. As such, even if the xanthelasma doesn't pose a cosmetic concern, it is crucial to understand that it could represent a significant health risk. Consulting a doctor to evaluate your cholesterol levels and overall cardiovascular health is a wise step. By addressing the underlying cause of the xanthelasma, you can reduce the risk of developing heart disease. 4. Arcus senilis, deposits on the cornea and lipid imbalance. Arcus senilis is a condition where a grayish or white ring forms around the cornea, the clear part of the eye. This condition is commonly observed in older individuals and is often associated with aging. However, when arcus senilis appears in younger people, it could be a sign of an underlying health issue, such as dyslipidemia, an abnormal amount of lipids in the blood. Dyslipidemia can lead to an accumulation of fat deposits in the blood vessels, contributing to the development of atherosclerosis, hardening and narrowing of the arteries. If you notice a gray or white ring around your cornea, it's important to consult with an ophthalmologist or healthcare provider to rule out any underlying lipid disorders. In some cases, treating the underlying condition can prevent the progression of heart disease and other vascular issues. The presence of arcus senilis, especially in younger individuals, should prompt a thorough evaluation of cholesterol levels and overall cardiovascular health. By addressing any lipid imbalances, you can significantly reduce your risk of heart disease and improve your long-term health outlook. 5. Cyanosis, bluish or purple skin tone. Cyanosis is a condition in which the skin or mucous membranes, such as the lips or fingertips, take on a bluish or purplish hue. This is a clear sign that your body isn't getting enough oxygen, which could be due to heart or lung problems. The skin typically appears pink because of oxygen-rich blood flowing under the surface. When oxygen levels are low, the blood turns darker, causing the skin to appear bluish. If you notice cyanosis in yourself or someone else, particularly around the lips, fingers, or toes, it's a warning sign that the heart or lungs may not be functioning properly. Cyanosis can occur when the heart is unable to pump blood efficiently or when the lungs aren't oxygenating the blood adequately. In either case, this is a medical emergency that requires immediate attention. There are two types of cyanosis: central and peripheral. Central cyanosis affects the lips and tongue, and it typically indicates serious issues with the heart or lungs. Peripheral cyanosis, which affects the extremities, such as the fingers and toes, may be caused by poor circulation or reduced oxygen levels in the blood. Both types of cyanosis should be evaluated by a doctor to identify the underlying cause and begin treatment. 6. Fatigue and shortness of breath during physical activity. Unexplained fatigue or shortness of breath during physical activity is another red flag for heart disease. The heart is responsible for pumping oxygen-rich blood throughout the body. When it becomes weaker or less efficient, your body may struggle to supply enough oxygen to meet the demands of physical activity, leading to fatigue, breathlessness, and dizziness. This type of fatigue is different from the typical tiredness that comes after a long day. It's persistent and may occur even after minimal exertion, such as walking up a flight of stairs or carrying groceries. If you experience this type of fatigue, along with shortness of breath, chest discomfort, or lightheadedness, you should seek medical attention immediately. These could be signs of heart failure, arrhythmia, or coronary artery disease. Heart failure, in particular, occurs when the heart can no longer pump blood efficiently, leading to a buildup of fluid in the lungs and tissues. This results in symptoms such as shortness of breath, fatigue, and swelling in the legs or abdomen. If left untreated, heart failure can become life-threatening, so it's critical to get diagnosed and treated as soon as possible. 7. Chest pain or tightness. Warning of heart attack. Chest pain or tightness is one of the most recognized symptoms of heart problems, particularly in cases of heart attack, myocardial infarction. This type of pain is often described as a pressure, tightness, or squeezing sensation in the chest. The pain may radiate to the left arm, neck, jaw, or back, and can last for several minutes. If you experience chest pain or discomfort, especially if it is accompanied by nausea, sweating, dizziness, or shortness of breath, you may be experiencing a heart attack. In this case, it's vital to seek emergency medical care immediately. A heart attack occurs when a blockage in one of the coronary arteries disrupts blood flow to the heart muscle, causing tissue damage and loss of function. Early intervention is key to minimizing the damage caused by a heart attack. Medications, procedures like angioplasty, and sometimes surgery can help restore blood flow to the heart and improve outcomes for those experiencing a heart attack. Therefore, recognizing the signs early and getting prompt medical attention can save lives. Heart disease remains one of the most significant health threats worldwide, but many of its early warning signs are visible. By being proactive and recognizing these signs, you can take steps to protect your heart and reduce the risk of serious health complications. If you experience any of the symptoms mentioned above, it's crucial to consult a healthcare professional for further evaluation. Maintaining a healthy lifestyle, eating a balanced diet, exercising regularly, managing stress, and monitoring your heart health through regular checkups is the best way to prevent heart disease and ensure your long-term well-being. Remember, prevention is always better than treatment, and by staying vigilant about these warning signs, you can make a significant difference in your heart health and overall quality of life.
If you enjoyed this video, hit the like button and subscribe to our channel for more informative videos like this one. Thanks for watching.